So we're going to be talking about boosting libido naturally, and this timing for this, of course, is wonderful, being as that it's Valentine's Day here for us. And when we're coming to think about things like libido, we're starting from a naturopathic approach here at Prosper Natural Health. So I'm Dr. Molly Force, and I'm the clinical director here. I'm joined with Dr. Rosalie and Dr. Mary today. And we all are naturopathic physicians, which means we're really trained as primary care doctors, but we like to take a holistic natural approach whenever we can. So the beauty in that for us is that as primary care in the state of Washington, we can use things like pharmaceuticals, but we really like to figure out what the root cause is for our patients, think about the physiology of what's involved for them, and come up with individualized treatment plans that are natural whenever possible. So using things like diet and herbal medicine and the understanding of ways to rebalance homeostasis, that balance that our bodies are all craving and looking for, is our primary goal. So these two physicians that join me today here at Prosper are extra special because they have dual degrees, which means they also are specialists in other natural fields. So we've got Dr. Rosalie, who's specialized in Ayurvedic medicine, and Dr. Mary, who's specialized in traditional Chinese medicine, which includes acupuncture. So because of that, we really like this balance of kind of East meets West with our traditional holistic medical models here. So when we're talking about something like libido, we are really wanting to give you guys topics this year that are very tangible and usable. And it's a huge topic. You know, libido can be caused, or changes in libido can be caused by so many different things, which we're going to talk about some of them today. But we wanted to really spotlight our doc talks this year. And what we mean by that is kind of narrowing the focus in so that we're giving you some really cool information that you can walk away with that's kind of usable for you. So today we're going to talk a lot about herbs. And let's just start from talking about libido in general and what it is and why this sensual health really matters to us, especially as physicians, why it's something that we want to bring up with our patients and get a good understanding of. So sensual pleasure and libido is not all about sex. That's not what it all boils down to. There's a greater reason that we have this, and it is a part of our health puzzle. And one of the big pieces there is that it provides some bonding in our social relationships, and it also involves these oxytocin and endorphin and dopamine pathways in the body. So these neurochemicals are pretty darn powerful for us. And we see these chemicals being involved in some of our relationships with other things other than just sensual touch. So things like sugar addictions, food addictions, or food restriction issues, and then also things like alcohol and drug addictions. So all of these can be imbalanced, and we might be seeing some of that when somebody's telling us that they're having an issue with their libido, and that's kind of giving us some insight that we're having an imbalance in some of these neurochemicals and how they're working in the body. We also know that sensual health and that perception of touch deeply affects our autonomic nervous system. And when we're thinking about this balance within our nervous system, that autonomic nervous system is the one that's associated with rest and relaxation, and really is very important to the calming, that rest and digest sort of side of things. So when we're thinking about this as a holistic
Mm,
piece, we just want to remind you not to kind of reduce it down to just the sexual pleasure piece. Now, that is really important as well for so many reasons, and we're going to talk about some of the specifics there today. We've even found things like immune system being regulated. To some degree by things like clitoral stimulation. So there's some interesting little pieces and tidbits we hope you pick up on today. But the main point here is this is a big deal for how our health is being affected if we're finding that we're having imbalances with libido.
okay. So next we're going to dive into some of the physiology of libido. And this is just going to give us some context for how to understand the way that our treatments work later on. So the majority of our talk will be involving herbal medicine and some kind of simple ways to get started with enhancing libido. But first, I'm just going to talk about how it's produced and what gets in the way when it comes to arousal and sexual excitement um, and the kind of comfort in sexual encounters. So in the brain, there's what we call the dual control mechanism or dual control model of sexual arousal. So there's two different parts to our ability to feel sexually excited and aroused. And one of these sides is called the gas pedal. So these are the things, whether it's visual, sensual, memory stimuli that make you feel aroused. And then there's the brake pedal, and that is things that are getting in the way. That can be things you're worried about, relationship issues, anxiety, past trauma, and things like that. And so when we're talking about the central nervous system or how we're processing these signals in our brain, we want to think about both things because both will impact our ability to then have all of the physiological changes that help us have a pleasurable experience. So that just basically means, when you're working with your partner and developing sexual intimacy, you want to think about not just the kind of plus side of what stimuli are making you feel aroused, but also what's preventing you from feeling aroused, and look at those as two separate things. Um, Next, we've got testosterone and estrogen. So we know that both of these hormones can enhance sexual arousal. But what we found is that it's the testosterone to estrogen ratio in our body that can really impact our sexual libido to a larger extent. So that is typically a slightly higher testosterone to estrogen ratio. And that's going to be different in that balance, and what is healthy is going to be different in every individual. Next, we've got the nitrous oxide that should be nitric oxide pathway. So this is a pathway that allows our blood vessels to dilate. Nitric oxide is a chemical that acts on this muscle that exists inside our blood vessels. And that pathway allows our body to send blood around to different parts of our intestines and our muscles, depending on what we need to do. Now, Dr. Molly was mentioning the autonomic nervous system. So this is our involuntary nervous system, and it's the thing that really directs whether or not we're kind of getting ready to be in stress or fight or flight mode, or if we're more in a rest and digest mode, which is what we want when we're getting ready to, be with our loved ones and eat and engage in pleasure. So when we're in that rest and digest mode, the nitric oxide can actually act on the vasculature of the genitals and enhance blood flow to that area. So that allows for erections, it allows for the area to kind of fill with blood and get a little bit more plump. Interestingly, this happens in both males and females. So when we're talking about, issues with erection and how that can affect sexual pleasure, we're talking about women too, or female anatomy as well. And that, so on the right-hand side here, you see the internal erectile tissue of the female anatomy. So the glands of the clitoris is just kind of the tip of the iceberg in terms of this organ and how it functions. And then we have the corpus cavernosum, which also exists in male anatomy, and that kind of travels along the pubic bones deep in the pelvic cavity. And then we have the bulb of the vestibule on both sides, and that wraps around the vaginal canal. So lots of erectile tissue in both males and females, and we're going to talk a bit later about how we can influence these vasodilatory pathways in both males and females. So these are just a couple of things to think about in terms of the causes of low libido and sexual dysfunction. And, some things are a little bit more obvious and some you might not think about. And it's good. This is just kind of a reminder to reach out to us as your, or any healthcare provider to really dig into what the underlying cause of the sexual dysfunction is. So here, first, we've got mental and emotional issues like depression and anxiety. Also, tension in a relationship can cause a lot of, can be one of the major breaks that we have in terms of that dual control mechanism. And we really want to address that as part of our healthcare plan. Next, we've got erectile dysfunction, again, that can happen in both males and females and affect sexual pleasure. And that is often related to vascular issues like cardiovascular disease. Diabetes can be one thing we want to think about. And then smoking is a major risk factor that we'll want to address if that's present. And then the last few ones we have here include pelvic floor dysfunction. So, any tightening of the pelvic floor, particularly in people with vaginas, when you have any pain or long-term pattern of pelvic floor dysfunction, that can really impact your ability to really enjoy sexual pleasure. And then lastly, we've got the vaginal microbiome. Recurrent vaginal infections can cause a lot of vaginal irritation and impact our sexual relationships. And then we've got hormones. So again, that low testosterone to estrogen ratio can affect largely our kind of motivation and libido for engaging in sex with partners. All right, so next we're going to get into the aphrodisiac herbs section. And first I'm just going to introduce what aphrodisiac herbs are. So these are known as agents that arouse desire, and they can come in the form of pharmaceuticals, food, and herbs. And we're going to focus on herbs here. So the term is derived from the Greek goddess Aphrodite, the Greek goddess of love. And the main actions that it can have on our bodies are by increasing libido or sexual desire, increasing erections, both penile and clitoral, and increasing sexual pleasure. And we'll get into what that means later. And then we have a number of what we call herbal categories whereby herbs can act in a couple of different ways to affect sexual pleasure. So we've got nervines. So that is an herbal category that is largely helpful when it comes to relaxation. So, when anxiety and stressors are getting in the way of engaging in that part of our sensual part of ourselves, nervines can be really helpful. Next, we have adaptogens. These are herbs that help us adapt to stress. We often use them through periods of prolonged stress, and they can affect our stress hormones, often by decreasing the release of the stress hormones and kind of providing a more even level of stress hormones throughout the day. And then lastly, we've got circulatory stimulants. So again, when we were talking about that vasodilatory pathways, improving sexual pleasure in both males and females, many herbs that we're going to be talking about are working to send blood flow to the genitals. So you'll see these themes come up in the next section where we're really going to dive into the research behind the herbs. Okay, so first off, we have Damiana, also known as Turnera diffusa. This herb is native to Mexico, and it's been used for centuries to stimulate male sexual function and performance. That was kind of the historical use of it, but really now it's used for both males and females. Its indications are for low libido, erectile dysfunction, and as a nervous system tonic. So it's known as an anxiolytic and an antidepressant. And so there's a number of studies that have been done on this particular herb. And so the main ones that have shown us how it works have been done in rats. And what they found was that they saw with administration of a Damiana extract to laboratory rats, they showed increased copulation and sexual activity in rats that had been sexually inhibited. They also found that this herb is shown to function via that nitric oxide pathway. So I didn't mention this before, but that's one of the main mechanisms that Viagra works through. So, sildenafil, it's a common pharmaceutical. This is kind of a more gentle way of improving erections and thereby increasing libido and sexual pleasure. So here are some of the names of the studies if you want to go back and really dig into them yourself. But those are the main mechanisms that we've identified in the scientific community for Turnera diffusa.
Thanks, Dr. Mary. I will explore 3 more herbs here, and then Dr. Molly will finish us off with a couple more. But these next 3 come also from the Ayurvedic tradition, which is traditional medicine from India. So you'll see me refer to sort of the Eastern perspective here for these herbs. So ashwagandha has been used for many years, especially in India. In Sanskrit, it means the smell of a horse, in that, we're thinking of like the virility of a stallion, right? So that's kind of, it's the etymology ultimately when it comes to Ayurvedic medicine in Sanskrit. But it's been used not just in Eastern medicine, but also has found its way into Western medicine as well, and used in a couple of ways, especially when it comes to erectile dysfunction, and specifically what's known as psychogenic erectile dysfunction, which means the mechanism is working, the machine is working, but the mind is not, right? So sort of getting into the mood is what's difficult for finding sexual pleasure. So that's where ashwagandha can really shine. It's also helpful in terms of stress-induced sexual dysfunction. So this is both male and female, in the sense that, you know, a really stressed out mind can really lower desire, right? Ashwagandha is used as an adaptogen, which is a word that means it's an herb that modulates stress. So it also can be used in this way. Next, I've seen some studies that are very promising when it comes to male infertility, and specifically increasing sperm count, which is pretty amazing, especially for our couples who are trying to conceive later on in life, where there's both male and female infertility that are often seen. And then it's also a herb that increases what's known as DHEA sulfate, which is just a precursor molecule to our androgens or our testosterone. The more testosterone we have, the higher the libido. I even looked just this morning to see if there were even more studies out there than the ones that we listed. And indeed, just a few months ago, a study came out, a randomized control trial from 2022 that showed very promising results in terms of male-specific sexual function. So yeah, a lot of promising data here for ashwagandha. Nutmeg is another favorite, and this one might surprise you, right? We don't often think of nutmeg and sexual function, but it's a plant that's native to East Asia, Indonesia specifically, and it's used in Ayurvedic medicine, has been used for many years for premature ejaculation, and it has its specific function there is as a circulatory stimulant. So it helps circulation all throughout the body, including in the erectile tissues. It's also helpful for low libido. So again, it sort of increases the sexual energy ultimately. And there's a couple of great studies, including one in 2020 that looked at all sorts of different traditional plants and compared them head to head, showing that nutmeg had a pretty potent effect on libido specifically. Saffron is another one. I use saffron for a couple of things, for depression, but also for libido and erectile dysfunction. When we think about saffron, I like to think of it as sort of a plant that helps in the mind first and foremost. And so if you're familiar with the side effects of antidepressants, one of those is low libido, especially an antidepressant known as fluoxetine. And so there's a lot of good studies that have shown that side effect of low libido from the antidepressants can be diminished by taking saffron along with it. So that's really helpful in terms of combining those two therapies. It also has been shown to help with male infertility, and specifically the morphology and motility of the sperm. So when we look under a microscope at the sperm, we look at what do they look like. Are they sort of strong looking with a nicely beating tail, and are they very mobile, right? And so saffron helps with both of those things when we look under the microscope. And I'll have Dr. Molly do the next herbs here.
So yohimbe is the next herb we want to address. Now, this is a bark which is derived from Central Africa, and many of you may have heard of yohimbe. It's gotten a lot of attention because it can be very helpful for ED, erectile dysfunction. Specifically, there are some really cool studies that show that it helps very much with this orgasmic dysfunction that happens and erectile dysfunction. We also have studies that show that it's helpful when antidepressants are involved. So once again, like Dr. Rosalie was saying, many of our antidepressants, and we know about 1 in 10 Americans are on an antidepressant, many of them as a side effect cause low libido or even sexual dysfunction, with affecting things like erectile dysfunction at the tissue level. So it's pretty cool to be able to have an herb that can help address that. Now, another piece here that we know from the yohimbe research is that it can be really helpful for performance anxiety. And of course, that's that whole other side of things when it comes to libido and performance. So that can make a big difference for a lot of people. Another herb we wanted to make sure to address that has really cool studies behind it is maca. Now, maca is native to Peru and it's a root, and there are 13 different varieties of maca. So there's some nuance to prescription here. Now, the people of the Andes didn't just give the same type of maca to everyone in their culture. There's specific timing for when different types of maca is harvested, and that will affect the constituent levels within there, and it'll affect the hormonal output from that herb. So it's really cool because we know from the documented literature that it helps, once again, with erectile dysfunction, especially if it's psychogenic, meaning that there's a mental processes that's involved in that type of erectile dysfunction. We also know that it, according to the literature, helps with, once again, this antidepressant induced sexual dysfunction. And then we see, just like with yohimbe, it helping with performance anxiety as well. So the other piece that maca does is just pretty cool, is that it is considered an adaptogen for the HPA axis. So that's the hypothalamic pituitary adrenal gland axis. So this is this communication that we have between these hormones for output of things like our estrogens and our progesterones and our testosterone. So we know that it can help modulate that, like Dr. Rosalie had mentioned with adaptogenic herbs. This is one that will help adapt to a person's system. Now, there are 3 main types of standardized and gelatinized organic macas that we use here at Prosper, although sometimes we're also using maca in different formulations or even powdered as a nutritional supplement in different forms. But a lot of times when we're using it medicinally, it's very wonderful to have this form of standardized maca because we can understand the milligrams that we're providing. We have better absorption. It's something like 99% more absorptive when we have it in this gelatinized form, and we know it's coming from the specific type of maca that's appropriate for the differing life cycles. Specifically, a lot of this research is done for females. So when we're thinking about this, we're going to want a different type of maca whenever we're cycling and in the menstrual stage for a female than when we're postmenopausal. So there are 3 main types that we're using in our practice. One is for cycling women, and that's this Harmony, the Feminescence Harmony product. For women that are still cycling but starting to have some not abnormal, but some normal changes that happen around menopause and are in perimenopause, there's a perimenopause specific formulation. And then there's a postmenopausal formulation too for women who've been without their cycle for at least 2 years. Now, there's really not wild, but really cool research with these specific gelatinized forms of maca. We see that women who have irregular menses cycles and who are having issues with libido, that are still in their cycling years, still in their fertile years, within 1 to 4 cycles, the majority of them, according to the clinical studies are seeing a difference whenever they're on a gelatinized maca, like that feminescence harmony. For women who are postmenopausal, we see within 2 to 4 weeks, with an average being 3 weeks, about 80% of women responding with decrease of the menopausal symptoms if they're having symptomatic menopause. So that's things like their hot flashes, sometimes things like mood shifts, and then of course low libido, which is so commonly seen with menopausal changes. So this is just a cool herbal tool that we have at our disposal. And then the other piece we wanted to make sure that we addressed with you guys today is because there can be so many causes of libido shifts and hormonal and these neurochemical signaling shifts and even circulatory shifts, it can be very helpful for our patients when we start with some basic blood work. And there are 3 main blood panels that we're thinking of whenever we're concerned about libido issues for our patients. There's this, what we call our basic wellness panel, which is quite large, that we like to see on an annual basis when possible for our patients. And that includes things not just like our anemia panel, and that's CBC, and our metabolic panel, which looks at things like our liver function and our kidney function. But it also includes our things like our iron levels and our lipids. Now, believe it or not, our cholesterol is a backbone for a lot of our hormones, our steroid hormones. So we do like to understand what's going on there. And then, of course, if we have something like a challenge with our erectile dysfunction or a challenge with our circulatory system, even in females, we may be having issues with tissue perfusions. That means blood flow to those tissues that help those tissues that would be stimulated during arousal. That can be really helpful to understand what's going on with our lipids. And sometimes we're recommending at that point a cardiovascular panel. And our cardiovascular panel looks not just at our standard lipid profile, but it breaks down those lipids to look at the buoyancy of those cholesterols to get a really good understanding if there might be some kind of arterial or vascular issue going on. And then we are also looking at inflammatory markers there too, like our CRP and our homocysteine. And those can be invaluable when if we're concerned about vascular pieces. Now, the other piece for us is looking at things like if somebody's having libido issues that's psychogenic, that has to do with how they're seeing and perceiving their body, maybe their comfort level in interacting with their partner, those kind of things. Sometimes there can be metabolic reasons that might be causing them to have certain imbalances in their body and in their metabolic makeup that we need to look at as well. So that's things like looking at what's going on with thyroid and potentially doing something like our weight support panel to look at what's going on with metabolism and what's going on with blood sugar as part of that. Now, of course, blood sugar can be another big piece that affects our vascular health and how things are circulating. And then, of course, metabolism and energy levels as well. So the other side is, rather than our blood testing, is our salivary testing. And salivary testing can be really critical for us in understanding what's going on with our adrenals and our sex hormones. So this is one of our favorite ways to get a really good understanding of those free circulating estrogens, testosterone, looking at progesterone, looking at those ratios and how they're interacting with a person's body. And then, of course, also thinking about cortisol. So cortisol is one of our main adrenal hormones, and we can get really good, accurate information about that diurnal 24-hour cycle as far as how our cortisol is being regulated. And that cortisol can be a big marker for stress, anxiety, sleep disruption, and all of those are so critical in getting addressed if there is something going on with libido or that ability to have that sensual arousal. So that's kind of the way that we are addressing our testing with our patients and starting that discovery process, which is so very critical in getting to the root cause whenever there's an imbalance going on in this arena.
Okay, thank you, Dr. Molly. So next, we're just going to dive into a basic treatment plan and some ways to kind of get started and things to think about. So we talked about the herbs. So that was kind of a more in-depth look at how we use aphrodisiac herbs. But we have a number of other things that we think about as naturopathic doctors for a holistic treatment plan. So one of the first things that I'll often talk about with patients is having an open conversation with their partners. So, there's so much about whether it comes to erectile dysfunction or changes with menopause, there's just so much shame and, insecurity that can come along with that. And talking about sex can be so taboo that a lot of couples are not practiced at talking about it. But talking about sexual preferences and what's working and what's not working can really develop a lot of trust in a partnership and lead to an openness that can be really useful for facilitating that connection. Another thing we really want to think about is stress management. And this is going to be really individual to each person. So whether it's meditation, exercise, cooking, reading a book, ways to kind of shift out of your stress mode, of work mode, and into home pleasure, all of the other more kind of the beautiful aspects of life. It's really important to be able to engage with that and shut your active brain down at the end of the day. We also want to think about exercise. So this is a great way to, largely improve our vascular system. And that can have a major impact on our ability to send blood flow where we want it to go. And that can, again, impact our erectile, our ability to engorge the genital area when during sexual activity. And it can also play a big role in stress management as well. We want to look at the underlying conditions and treat that, whether it's cardiovascular disease, diabetes, depression, really think about a broader umbrella of what what the lack of sexual pleasure, sexual dysfunction is related to, and address that. There's some certain specific circulatory stimulants that we'll bring in to improve that blood flow. And some of those can be in the form of either herbal extracts or food. So that's ginger and cayenne. Ginger and cayenne are some of our major circulatory stimulants, but there are many more, often come in the form of really aromatic, spicy herbs. And then there's a product that we have here that I love called Nitric Balance that has a number of herbs and supplements that support that nitric oxide pathway specifically and help us vasodilate when we want to. And then lastly, we've got sensual stimulation and openness to a variety of sexual practices. So again, as we age, what is possible, what is enjoyable with sex can change pretty drastically. And having resources and tools at our disposal to engage with sex at different stages of life is really helpful. And so thinking about vibrators, thinking about toys, and kind of broadening the way that you engage with sexual pleasure can be really helpful if you are encountering any roadblocks. So there's a number of sex coaches in town that can be really great resources to reach out to if you are wanting to discuss that with your partner or just for your own pleasure or trying to get past a roadblock within yourself. And we also have a really amazing boutique women. It's known as a women's health store and holistic sexual wellness store in town called Vespertine. And they have a really great selection of vibrators and sexual toys and many things, lubricants, healthy lubricants, tools for pelvic floor support. There's a really amazing resource to have in town and have some great people that you can talk to for guidance. And you can stay tuned. I will be doing a workshop at Vespertine in the next few months where we'll discuss discuss sexual health through the aging process with Oshena, who works there. So stay tuned for that and just go and check them out if you're ever interested. They're really great people to talk to.
Thanks, Dr. Mary. So last few slides here are sort of looping us back around to Ayurvedic medicine, which is our traditional medicine from India, meaning the science of life. And so as we discovered earlier, the causes of low libido are multiple, right? You sort of start in the brain. Is there something going on with the mood? And then you continue down in terms of how is the whole body health, right? Is there blood glucose dysregulation? Is there calcified arteries? Is there low circulation, right? And then we go from sort of what's going on in the mind to what's going on in the body. And ultimately that is steering us in terms of which treatments do we end up using. In Ayurveda, it's a little bit similar in that there are 7 tissue layers that sort of when you eat your food, it goes from one tissue layer all the way to the 7th tissue layer. It's sort of digested that way. And so your 7th tissue layer is essentially your genital organs and your ability to procreate. And so if upstream, if what you're eating is not supporting that 7th tissue layer, then it's going to be really hard to have enough sexual energy at the end of the day. So the treatments for low libido are a category known as the Vajikarna type of treatments, which are our aphrodisiacs, and they support that 7th tissue layer. And through supporting the 7th tissue layer, we're also supporting the 6th beforehand. So one of my favorite things to do with patients that are sort of coming in with low libido is to send them home with a recipe known as garlic milk. And it, surprisingly enough, is something that works really well. Garlic's a circulatory stimulant, and it's pretty hot in terms of Ayurvedic medicine. So not only is it sort of feeding, but it's also hot in terms of libido boosting. And so the way you make it is just mince 2 cloves of garlic and add that to a cup of coconut milk, let it boil and simmer for 5 minutes, strain and drink, and it's surprisingly quite delicious. So that's something you can try at home. And so lastly here, that sort of wraps up our talk on libido. I want to look ahead to next month's Doc Talk, which we've decided to do it on vitamin D, and specifically how much vitamin D should we be taking, since the medical field is pretty divided on this topic, and it's hard to know what form, how much, when to take it, etc. So we're going to debunk all of those questions and help orient you there.
So we want to make sure we have time to answer any questions. We know we've covered a whole bunch of different topics. I'm loving this idea of the garlic milk and thinking about that as a neat little thing you can try pretty easily at home. And we really appreciate you guys joining us today. We're here at Prosper. So let us know if things are coming up that we can help you with, or if there's any testing you want to do to get a better understanding of what's happening for you or your partner. Any questions? Well, we really appreciate everybody taking their time today. Oh, do you mind? Do you want to put it into the chat? And that way it's available for. So yeah, guys, if you take a second and put it into the chat, then we can have it available that way, because we make this a recording that goes online for folks that weren't able to have it afterwards. So if you have a question, type it in.
Something else to note while we're waiting is that all of our doc talks, this one included and one from years ago, end up on our website. So if you ever want to refer to them again, you can always go on our website and explore all the topics that we have explored in the past.
Yep, there's an education, news and views sort of tab at the top that you can find them at. Well, we look forward to sharing some info on vitamin D with you guys next month, and we appreciate you. Happy Valentine's Day. Take care.